Well, I know I don't even have to wonder how. It doesn't take a genius to figure out how a physiotherapist can help with that, because the exercises definitely would help burn calories and yeah.
Absolutely.
Yeah.
Absolutely.
But pregnancy does come with extra weight in a way, doesn't it?
It does. But you have a certain amount of weight that you should gain. Now you can gain more than that, and if you do, then you are running into problems, because it can lead to things like your hypertension, diabetes. So other medical conditions can be acquired because of the excessive weight gain. And I'm using the word excessive. Yes, you are supposed to gain weight. So in terms of physiotherapy and for maternal health, watching their weight, so the exercises. Now you cannot do that without diet as well. So correcting them on the proper eating, proper foods that are eaten, times that you eat, all that is important. So you have a total picture.
I get the impression your work is not isolated. You work alongside pari passu, other healthcare providers.
Very much so, very much so. With the medical doctors, with the dietitians, with psychologists. We always forget about postpartum depression and all that. So with the psychologists, we work with, we're getting occupational therapists that are coming to the system now, with the nurses. So everybody within the healthcare environment we do work with. Yeah, they're part of the team.
Okay. I don't suppose your approach is a one-size-fits-all. I'm sure there's specific exercises for specific cases, especially during pregnancy. Could you, juxtapose maybe two different cases and see how, the physiotherapist helps in both cases?
For sure. For example, if you have someone who, because of their posture, which is the most common one, because your pelvis extends so that your stomach can grow and the baby can have space to grow. And with the increased size of the front, it puts a lot of stress on the lower and the lumbar spine. So you would, in that case, they probably have pain. Now that is normal, but if they have, a lot of pain, then you're looking at treating them.
That accounts for the back pain, the lower back pain many pregnant women complain about?
They can do. So if it does, then you can do treatment for that. Now, I mentioned that the pelvis also will open up, so your pelvic bone will relax. The ligaments and the connective tissue will relax the pelvis, so baby has room. Now sometimes the relaxation is a little too much, and so they have imbalances, and sometimes they have a problem even walking. So putting pressure and weight. And so again, a lot of advice. There's certain exercises specific that you can do for controlling this, a sacral belt that the pregnant mom can wear to try and support the pelvis a little bit more, allow them to be able to walk better. Then you have the pelvic floor itself. So with the weight of the baby and with the delivery, you can have damage to the pelvic floor. So again, we'll do training in teaching them how to strengthen their pelvic floor muscles again.
Are there special circumstances under which you won't advise exercise or any form of strenuous movement for a pregnant woman? I could give an example. Well, I'm not reliably informed, but I gather women who go through in vitro fertilization, for instance, are more sensitive, are more fragile, and usually there's a no baby, no home policy. They're restricted in the hospital until they put to bed. So would you say there are circumstances under which you won't recommend a physiotherapist to work with a pregnant woman?
Absolutely. If you have any sort of vaginal bleeding, if there's any kind of discharge or bleeding through the pregnancy, absolutely not. If they are somebody who's had multiple abortions or loss of the baby, again, you want to be careful. And not saying that they shouldn't do anything at all, but you still can do a certain amount of activity with them. You can do, even if they're put on bed rest, you can still do some pelvic floor exercises. You can still do some isometric abdominal contraction. You can still teach them posture, how to lie down so that they're not putting stress on themselves.
All these under the supervision of a qualified physiotherapist.
Of a qualified physiotherapist. Yeah. So again, you work with the doctor. So if they feel that the OBGYN feels that they are high risk, then you want to be very cautious about what you do, or potentially absolutely nothing at all if they're supposed to be on bed rest.
I'll come to you, Abigail. But when should you be alarmed as a pregnant woman undergoing some physio? When should you? What are the contraindications? When should you say no? I have to put a stop to this.
I think if you're having discomfort, if you're having pain, if you notice any kind of a discharge, if when you go for tests and the baby's lying breech, if baby drops a little too fast, too quickly, all the situation, or if you're found to have exceptionally high blood pressure, You have preeclampsia. So there's certain condition situations where, yes, you will have to make sure that you don't. And for a pregnant woman, you know your body, and you have to know your body. And unfortunately, a lot of women do not know their bodies. And so you have to know your body. That's
strange. How do you mean? Yes,
it's a whole topic on its own.
You would think that, well, this is mine, and so I know everything
being
about
able
this
to
body.
Feel
So how do you
mean?
mean?
Being able to feel that there's something wrong, and knowing that I have to do something about it, and not feeling that, oh, I'll wait, it will get better. It's one of the things that we are very fond of, is that, oh, I'm sure it'll be okay, I'll rest a bit, or I'll leave it.
Or get a painkiller.
Get a painkiller, press. There's the whole variety of things. But you should know that if you recognize that something is not feeling right, something is not correct, if you see yourself discharging, if you find that you're getting pain in the abdominal area, lower abdominal area, your back pain is different than what it has been. So you need to be able to feel and make sure that that information is portrayed to your doctor. So
how involved are physiotherapists in all of this? You see, I'll give an example. Elsewhere, you find that pregnant women, and I suppose it depends on what stage of trimester they're in, would go through classes, usually even with their husbands, with their partners, would undertake some classes. I see pregnant women squatting and learning to breathe. I mean, just so in case the baby comes, at any point in time, even the husband can help. Do we have anything? I was amused when I saw that, because I said, this is never happening in Ghana. You're on your own if you're a pregnant woman. But do we have anything, in this guise here?
I know that I think there's a couple of prenatal programs. How comprehensive it is, unfortunately, I'm not able to say. But yes, usually there is a prenatal program, not what we usually do in terms of going to hospital and checking your pressure and making sure baby's okay. But an actual program, as you say, in having a talk, from the physician, from the OBGYN on the choices they have in terms of epidural or any medication in delivery, and making a decision about having a vaginal delivery or a C-section. And then we do breathing exercises to help you through labor. Relaxation and labor, and then teaching the exercises to use to help to push properly. You do have to learn to push. It's a natural thing. You feel you have to push, but if you're taught how to do it effectively, you are more efficient.
Is it something you can teach on TV right now? Is it something? I would love to know. I plan on having triplets. I want to know all, get all the information, be furnished with all the information I need. Really.
Well, you have to come. I'm going to run a class, so you come. And the class is usually not one class. It's usually maybe for 6-8 sessions where you learn to do abdominal, low abdominal exercises, so tensing of the low abdominal muscles, your pelvic tilting for your back to put your back into posture, and the pelvic floor. Inside, learning to be able to relax those muscles properly when you're pushing to allow baby to come, which prevents tearing and having to have.
Yeah, talking about my triplets, I just remembered to ask this: are there special exercises for women carrying multiple babies?
Not necessarily. No? I don't know if there is any extra exercises as such, but I think the healthier, what it might do is that the weight that you gain may not be any more than having one baby. The babies are going to be smaller when you deliver them, so you're not going to have.
Okay, I'll feed them.
They'll be fine, I'm sure. But possibly doing better work in terms of the strength in being able to deliver repetitively for 3 times.
Right.
Yeah. Right. That could be hard on the body.
So you don't necessarily have to undergo any operative delivery section.
They can. Yeah. If you have a C-section, of course. But people deliver.
Physio can help people not undergo C-sections. Or is that not your domain?
Sometimes it's a choice of the mother to have a C-section. But I think that if you've done good breathing, labor and delivery, preparing yourself for it, you may find that you can deliver a lot better without as much stress. Right. But on the other hand, if baby's coming and there's distress there, the cord is tight, there's a lot of situations that when you come into labor, then they will have this. And people forget that when they have this section, they have an incision, and that in itself creates problems later on as well. So
Okay.
either way.
Yeah, I just want an epidural. Just cut me up and, pick it from under there. All right, so Abigail, let's see the activities you have lined up for PhysioFest 2016.
Okay, so PhysioFest begins today with media visitation from 9th to 11th of May. Then we will officially launch ourselves on the 12th of May at Charles Eastmont College Building at Kolebu. Yes, and then on 13th we have screening at Princess Marie Louise Children's Hospital.
What screening? Physio related?
Yes, we'll be measuring height and weight, we'll be checking BMI, and we'll be testing for hepatitis B, as well as blood sugar and all of that. These are important factors because people who are obese could have problems with delivery. If you look at maternal,
of course.
Yeah, if you look at the maternal population, and then other people who are not even pregnant, or other men, or anybody else could be obese, and that could cause a lot of problems. So we'll have counseling and education for such people so that they
Let's
know.
ban the men from coming to the screening. They shouldn't take the shine out of this for women. Yes, it's maternal health. Let's leave them out of it.
Okay.
Yeah. So otherwise, then finally, what you do? Usually, when I was in school, usually when associations have are celebrating their weeks like that, at the end of it, there's a Thanksgiving service. There's anything like that.
There's a beach party on Saturday.
There you go. There's supposed to be some fun in there somewhere. All right. Thank you very much. Thank you. Anna Huting, Madam Anna Huting is a physiotherapist, an amazing one at that. She's also a lecturer at the School of Biomedical and Allied Health Sciences in the University of Ghana. Abigail Ajay is her student. She's a physiotherapy student. She's the Public Relations Officer of the University of Ghana Association of Physiotherapy Students. Thank you, ladies. This was excellent.
Very much.
I have to come to your private clinic when I'm ready for my triplet.
Absolutely.
Yes. Thank you.
Prepare
All right.
you
So
for
remember, if you're pregnant and you must undergo some physio, some training, well, you must do it under the supervision of a qualified physiotherapist. You can't take chances.